Support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries.
We will do our best to not sensationalize public shootings like Sandy Hook or shocking displays of aggression and genocide to make a point. However, there is a line you can draw from those events to mental health. Managing, delivering, monitoring mental health services in our contemporary system is ubiquitous and ambiguous at the same time. And to compound this challenge, effectively diagnosing and defining care is a bit like trying to put a sweater on an octopus. Welcome and thank you again for supporting the most widely watched source of Carolina business and public policy. I'm Chris William, and these are some of the dialogues that matter right here on this program and right now. And this time, it's mental health. What is the true cost to business and to us personally and our communities? How does it get out of control? Where are its champions, and how, metaphorically, do we climb this mountain again to get an acceptable mental health system working well? On this special two-part CBR, a panel of 5 experts from across our region will help us get some clarity, and we start in just a moment.
Major funding also by Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. And by Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. On this week's program, Sheriff Chipp Bailey of Mecklenburg County, Debbie Dihoff of the National Alliance on Mental Illness, Dr. Peter Liggett from the South Carolina Department of Health and Human Services, Dr. Janice Probst from the South Carolina Rural Health Research Center, and Mebane Rash of the North Carolina Center for Public Policy Research.
Welcome to our program on this special two-part series about mental health. Our first part, we will talk about where we are now. What are the challenges? Where did we come from? On the second part, next week, we'll take a look at the way forward and how we take this information and apply it to possibly where the Carolinas are and need to go. Also, in the interest of full disclosure and full transparency, I do sit on the I am a member of the Board of Directors of the North Carolina Center for Public Policy Research that prominently figures in much of this mental health debate, at least on this program and also across the state and the region. Ladies, gentlemen, welcome to the program. Debbie, I start with you for better or for worse. You know, let's talk about mental health broadly. What is a generally accepted societal norm for taking care of mental health patients?
Well, you know, I think that it shouldn't be any different than taking care of any illness. We say within NAMI, North Carolina, that mental illness is a disease like any other. And yet, if you look at the history of what we've done for people who have mental illness conditions, it's been far, far away from what's happened for people with regular health conditions. You know, it's pretty shocking that until the Affordable Care Act came around just a couple of years ago, that there was no requirement for mental health coverage in insurers in the nation. Certain states adopted parity measures where the coverage would be on par with people who need coverage for cancer or diabetes. And that's what it should be. We should take care of people with mental illnesses and their families like we do all other physical health care conditions.
So Jan, our you know, our sense of community, our sense of helping others, how does that drive policy? How should it drive policy? And we're, you know, instead of having the policy discussion first, doesn't the genesis of this have to be to take care of our fellow man or fellow woman?
That's not a soft question, but I would say yes. I think with a person who is physically ill, it is obvious where they are hurting and why. If a person has diabetes, the doctor can draw their blood sugars and say exactly, this is what the disease has progressed to, this is what you need to do, Mrs. Smith. When someone has mental illness, it is so much more difficult to say, I am compassionate about this person who is talking to himself, perhaps not grooming, doing things for which we cannot see a physical basis, but for which in most diseases we have ascertained that there is one.
So this is stigma you're referring to?
Correct. Couldn't say it better. And I represent a rural health research center. That stigma keeps people from getting care all over South Carolina and North Carolina. You don't want to think people think you're crazy.
Right.
And certainly if you're in a rural area and there's only one mental health provider, you might not want to park your truck in front of that person's office. So the stigma affects the persons who need care, the persons who could help them get care, and unfortunately in many cases, practitioners even in medicine who think that mental illness is not as serious as other forms of disease.
So Mebane, is stigma, is it personal? I mean, is it internalized to the person, or is there a real discrimination still about mental health?
So I think one of the things that's important is just even how we've begun to have this conversation. Often it's not about us taking care of them or providing for them. It's about giving them access to the treatment and services that allow them to take care of themselves. Lois Curtis is an amazing example. She was one of the lead plaintiffs in the Olmstead case, and that's the Supreme Court ruling that required states to treat people in the least restrictive setting possible. So Lois, at about age 13, has been in and out of state psychiatric institutions for 26 years. And after that case, she's been living on her own. She paints, she sells her artwork on the internet, she speaks. She's going to be speaking in North Carolina on April 9th as a keynote address at the Disability Rights North Carolina. It's a remarkable story of empowerment. And so when you can get past the stigma and give people opportunities, recovery is within reach, and it's a beautiful thing to watch.
You know, Sheriff, you're back there nodding your head, and Pete, I'm going to come to you on this as well, but Sheriff, you're part of the institution. You're part of the services. I mean, how do you reflect on this broader question?
Well, in North Carolina, for a long time now, the jails, unfortunately, have become a place where the mentally ill end up for one reason or another, and we're not clinicians. For instance, 30% of my population, and I have a little over 1,900 inmates right now, about 30% are diagnosed. But we're guessing that there's about 60 to 65% when you include the undiagnosed who have some form of mental illness. It's caused us within the sheriff's office to try to get all of our detention officers, all of our deputies trained in crisis intervention training and for teamwork, crisis intervention teams. The police department here in Charlotte, Mecklenburg, they're putting all of their folks through, as well as every other municipality in Mecklenburg County. It's absolutely critical because more often than not, the police, the first responders, are the ones who are going to be faced with that 911 call where they show up and then they have someone who has some form of mental illness and are acting out. It's absolutely critical we recognize that there is a form of mental illness there and not just somebody behaving badly.
So first responder, law enforcement, they've got the training to deal with mental illness on the spot.
Well, we're working on it.
Yeah.
I mean, this is not something that's been around forever. It's just fairly new. And it started, I believe, in Tennessee, but it's fairly new. And crisis intervention training, every time we have it, which is quite often in Mecklenburg County, we'll have a room full of 25, 30, 40 officers and deputies. And it's as critical for my detention officers inside the facilities because of what I just said a while ago with the 60 to 65% of that population being either undiagnosed or diagnosed with some form of mental illness.
Mr. Director Pete, let me come to you and stay fairly broad here, and I'm going to read from the Center for Public Policy Research, Mebane, your group over there, that put out the State of Mental Health in North Carolina. It's a recent publication. And in the executive summary, it reads this, and I will quote, "The biggest problem with mental health reform," and this is in North Carolina, but I'm assuming this is going to be applicable. "The biggest problem with mental health reform has been the state's endless stream of changes in policy, funding levels, and leadership," and one person called it continuous, disconnected change. Are you nodding because you agree with that or because you understand it?
Well, I do understand it. We have had a lot of different policy shifts related to mental health. I think it's been a puzzle for our systems for many, many years, and I think you've already heard a number of really important themes come up, themes around access and capacity, around lifelong treatment, around people being housed in jails, getting treatment there, and I think really what we are needing to do in terms of looking forward, I know we'll talk about that later, is what does the right kind of treatment look like? How do we get access to that treatment, and how do we develop the appropriate capacity to serve the needs of the multitudes of people that have those issues?
So as we're just scratching the surface, and I wouldn't even say that accurately talks about mental health, but the dialogue and the debate that we talk about mental health, what do you think is missed in that dialogue? What's an important factor of this? Is it because there aren't any champions? Is it because mental health treatment is so open-ended? Is it because certainly the funding? Is it because of now the Affordable Care Act and you overlay that on top of mental health? What is it, the dialogue, that's not coming to the forefront that's critical to know?
I would say that what Mebane brought up, we need to talk more about recovery, because it really is no longer just about taking care of people. It really is about people finding themselves, and there are more new and exciting evidence-based practices coming out, like peer support services, where people in recovery are actually helping guide others to find their journey to recovery. But it means that the practitioners need to think differently. It means that the psychiatrists and the psychologists no longer have all the answers. It means that the person with the illness has to be fully engaged in their own recovery. And I think that's a big change from taking care of people to helping people take care of themselves.
Does the psychiatric community, Pete? That's your credential.
I'm a psychologist.
Right. So does that community embrace this, or is this a workload to say, well, wait a minute here. We're professionals. We have a practice. We expect to be compensated for our expertise, or is there some type of collaboration here?
I would say in general the provider community is embracing this, and there's wide variability, though. There are practitioners that continue to function in nice offices and expect their consumers to come to them, to their practices. And our medical health care system is really built around that model. And so the mental health crisis really, I think, exists in part because of our tendency to sort of wait for the consumers to come to us. We know that if consumers aren't seeking treatment, they tend to get worse. And so I think we are moving more toward a model which is more evidence-based, more recovery-focused, and also understands the importance of home and community-based treatments and supports for individuals with mental illness and also with intellectual disabilities.
Chris, there are psychiatrists in North Carolina that are really pushing the envelope on this. Dr. Sai Saeed at ECU says, "We live in times when the treatment of psychiatric disorders has never been more effective. Recovery from mental illness is possible and within reach." But he worries that people don't have access to those best practices.
You mean physical access?
Access, so rural areas. So one of the things he's doing is using telepsychiatry to connect people in very rural areas. 28 counties in North Carolina still don't have a psychiatrist. Figuring out ways to connect them through telepsychiatry to a psychiatrist at ECU or a psychiatrist at UNC or other places around the state.
Yeah, go ahead, Jen.
Well, Chris, I'd like to add, I teach in a business discipline, so I tend to think about where is the money. And I don't think we can talk about a mental health crisis in our two states without addressing the steady erosion of support. How do you show support? You show support by putting funding into a project. Beginning with the Reagan administration, which markedly eviscerated federal support for community mental health centers, and in South Carolina, in the period 2008 to the present, a 40% cut in state funding for mental health care. It's fine to say we can get these people in recovery. I know that's true. We know that's true. But unfortunately, all sorts of recovery processes, from diabetes to hypertension to schizophrenia to depression, take money to get access to practitioners and access to medications.
So Sheriff, let's go back to you. Your statistic pretty eye-popping. 60% of incarcerated people,
correct,
you think have a mental illness of some sort.
These are short-time incarcerated people. They're going to be back out in the community probably in 19 or 20 days on average for that inmate population. Now, I'll take it a step further and say that if they're dually diagnosed, in other words, they're substance abusers plus mental health, then you're looking at 80% of the population of our jail. That's of 1,900 inmates in that jail.
So when you argue the case for an increased budget, and in your case in Charlotte Mecklenburg, as sheriff,
right,
when you argue for an increased budget, is that one of the pillars that you will argue with? That, listen, we've become much more than incarceration and a Department of Corrections. We have become a rehab unit, and this is the reason why. And can you get those funds?
The answer is we get some of the funds, but our jails really are run in Mecklenburg County on the basis of programs designed to break cycles of addiction. We have 2 substance abuse pods, 28-day counseling substance abuse pods, 24/7 with those folks. The recidivism rate of a regular jail is about 70 to 75%. The recidivism rate of our substance abuse pods runs around 50%. So we've reduced it by about 25%, and that serves the citizens of Mecklenburg County. On top of that, it costs about $124 a day per inmate in Mecklenburg County to be housed. So we contract with a private medical provider, and they provide a psychiatrist. We have forensic counselors who work with these folks, also helping to recognize, and we do medicate within the facility with that psychiatrist. And all of this helps us not only deal with the folks, but get them into the programs that they need to be put into so that they can be successful when they get out. Our focus is on reentry. Not so much on just holding people, but we want, when we send them back out in the community, we want them to be functioning. We refer to it kind of tongue-in-cheek as, instead of being tax burdens, we want them to be taxpayers. We want them to be able to get jobs and support themselves.
So is this whole debate the mental health crisis that you called it? Is this about, and you can't say both, is this about money or is this about policy? Which one, if you had to put a stake in the ground, would you go after first? Anyone?
Being the professor and having nothing to lose, I'll say you can't forbid us from saying both. Money is an expression of policy. Policy drives where you choose to put your money, and we have not felt that mental health was a sufficient policy priority. And in fact, there was recently overturned, Medicare, for example, was proposing at one point to limit the use of certain types of drugs in the population it serves. Fortunately, they turned that back because within different classes of within the same class of drugs, different chemical combinations can have different chemical effects on patients. So that's sort of a victory of policy that Medicare decided not to enforce that limitation on medications. But that's a policy saying these people aren't important enough to get their medications carefully. Fortunately rolled back, that gets expressed in what people will pay for.
I'd like to interject there. You know, we're fortunate in Mecklenburg County. We do have the resources to be able to do some of the programs we do in the jail. But if policy, I would prefer not to be the provider of mental health services in Mecklenburg County. I would prefer that be outside the walls of those jails. So it is money. We need it to do what we do, but I much prefer the policies change so the jails are not the housing units for the mentally ill.
Yeah, we need to reverse that. If you look,
tell us what you mean by that.
Well, this is where money and policy definitely come together. What I mean is, over the last several decades, we have systematically decreased access to hospital beds, inpatient beds. And what's gone up? So that's gone down, and what's gone up is numbers of people with mental illness who are in jail. And that's we need to reverse all that. The policy needs to reverse it. Imagine having schizophrenia. It's not a walk in the park to have an illness like that. And then often because of the symptoms of the illness that are misconstrued by law enforcement, if they're not trained like they are here in Mecklenburg, you get arrested for a nuisance crime and you end up in jail. That costs society a lot of money to have somebody in jail. And mostly they're not getting better in jail. They might be here.
Not to interrupt you, Debbie, but let me, so Mebane, Debbie just said cost. What does this cost business annually?
Well, so I think funding drives the policy. So
Public funding?
Medicaid is the largest funder of mental health services, both nationally and in North Carolina, and that drives many of the policies. So as North Carolina is having a discussion right now about Medicaid reform, it is intertwined and inseparable from a discussion about the provision of mental health services in the state. And those two things are not going to be able to be separated. So in terms of dollars, $2 billion flows through the LME MCOs. Those are the people, are 10 units across the state that people come to for mental health services. They don't provide the service themselves, but they function like small insurance companies. They take the dollars, and then the people are able to use the money with providers in their communities. $2 billion flows through LME MCOs for mental health services in North Carolina. Compare that to the state appropriation, which is about $700 million now.
So, but do we have any, Pete, do you know any of the numbers in South Carolina to say, yeah, annually, this costs businesses, individuals, communities, X amount of dollars?
I don't know the exact number of that, but I do think that, to Jan's point, that when we look at policy decisions, it does make a difference in terms of how money does flow into the system. And we have had a system that is very clinic-based, very hospital-based system. And so, in South Carolina, we're looking at a system that gives us the ability to use some of the authorities that the Centers for Medicaid and Medicare Services give us to provide very unique and innovative home and community-based service approaches, such as supported housing, supported employment. And when we look at the problem that we have in not only in jails but in corrections, the issue really is what are we doing upstream and then what are we doing downstream? And we look at the Olmstead case, and we have an individual who's 13 years of age when she started her journey. What are we doing with children and youth to address their mental health needs? Are we doing that in the most appropriate way? Where are kids during the daytime? They're in schools. So is a school-based mental health approach really the best way to approach services for those youth rather than having people in clinics and hospitals? So.
And what is the answer to that question?
Well, I think it is a community, it is a home and community-based approach that we need to be focusing on. We need to be looking at individuals that are in our communities and what we can do. The question that's probably hanging out there is, what about Medicaid expansion? Would that create better access? Right. In South Carolina, since the Affordable Care Act, since 2008, we've seen our Medicaid population go from about 850,000 to over 1 million, almost 1.1 million people. I would say that even though more people have gotten Medicaid in South Carolina, access has not improved for those individuals. We still have a capacity problem. We still have an access problem. And so we've got to look at really unique and innovative ways to bring services to community-based approaches.
Hold that, because that's going to be on part two. We absolutely want to look forward to the ACA and how it's impacted, and we got about 2 minutes left. And anyone, Sheriff, I look at you. We talk so much about symptomatic issues that we can focus on here, the tactical issues. We can think strategically, but where does this mental health thing come from? Where does and I'm not asking you as a clinician, but can we be? Yeah, good, right? Can we be doing something different with our children in the home? I mean, does this stem out of some of the issues about the non-traditional family? And I don't want to say it that way, but the family. I grew up with a single mother. I grew up with a single mother. This is a different world now. How does this affect everything?
The only thing I can say is that we are so busy. Our world is so busy. Both parents are working. Those types of things. Sometimes early onset symptoms might be missed. They may not recognize something that a child is doing as something that would reflect a problem that needs to be treated. Is there a stigma in having a child go to a psychiatrist? I don't know the answer to all that, but I do know that the ones that we have to deal with It's manifested itself over the years without the kind of treatment I think that could have been given to that person at a younger age.
And that'll have to be the last word. Hold on to that, Jan, for the next program. Thank you. Please stay with us for next week, because we're going to talk about it then. Thank you for watching our program. Mental Health Part 2 next week. What do we do about it? Where are we headed? Until then, I'm Chris William. Good night.
Major funding for Carolina Business Review was provided by the Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.com.